Greetings. Today I'm here to talk about one of my favorite topics, and that's community and service. Often when we think of what is a community, it can be defined in many ways. But when we think about in terms of geography, in terms of where we live and how we define that community, that's a really powerful mechanism for looking at health as well, and how we describe that community. I do a lot in public health, and I have two teenage daughters, and they always say, "Mom, what do you really do? I know you're a doctor, but you don't see patients." And I always tell them that, my patient is the community. And that's really how I look at it in terms of I work for a health system, or if I'm working, whatever entity I'm working for, I really am a public health professional. And as being that public health professional, therefore, that makes the community my patient. And I do very similar things that a doctor would do when they're assessing their patient. You would take their blood pressure, you would, check their weight, how are they feeling? What ails them? What are their symptoms? And it's no different than when we're looking at community. So it's really no different than when we're looking at how we help our community. Certainly there are interventions and best practices, but it's really about caring and serving your community, just like an individual is going to be healed much faster when they know that someone cares and someone is connected to them. And so it's really no different than when we're looking at our community and how we're assessing what happens in our community. And so I really like to shift that paradigm in terms of, most healthcare is really focused in on an individual basis, especially here in the United States in terms of how we've allocated funding. It's really been that we've allocated funding one individual at a time. And although that's important, we all have individual needs, we also live in community. And so how do we look at community and really assess what are the interventions for community? What are best practices for community? And today I will really want to share kind of a journey and talk about what are some of those things that we can do in terms of healing and serving our community. Again, in public health, we have to look at, what are the things that are going to move the needle? Someone challenged me today and said, you're going to address poverty? What's a policy that's going to impact poverty? And it's really looking at, how we're looking at our communities. What are the social determinants? And those are often your income level, your education, other things outside of health that are significantly impacting the health of our community. And if we're not addressing some of those social issues, then we're really missing the boat, and we're not going to move the community needle in terms of looking at that health status. We can certainly look at the providers in our area and really redefine what providers look like. Is it not just primary care physicians or nurses, but what about our clergy? What about other providers in the community that are really serving? And how can they be an asset, and how can we utilize them to really serve our community? And then really looking at what are our community resources. I've done a lot of kind of multi-sectoral communities work. And one thing that I have clearly identified in terms of a determinant of health of the community is whether or not the different sectors engage and have relationship. That's really no different than the individual, right? In terms of what are their personal relationships and what are their relationships. So again, it's just translating what we know about personal care and translating that to the community. And really looking at it in a holistic perspective, that it really is all of the providers, many of the health conditions, and many of the community resources that we can mobilize. We often look at it from a deficit, and we all know what we don't have, what the problems are. But what if we could reframe that in terms of our community? Clearly, we need to identify what some of the challenges and issues are. But what if we were to then say, what do we have and what can we do with it? That's a much more empowering and life-giving mode. I always say I like to look at the prosperity and the abundance of what we have. It's a far more life-giving and energistic conversation than saying, what are the problems and how are we going to fix them? How challenging is it to really look at some of our own personal health behaviors and what's wrong with us versus really building on the strengths that we have as individuals? Different mindset. So I really want to talk about kind of this paradigm shift that's happening in healthcare right now. And I think it really relates to how we look at community. And it's very exciting for someone who's been professionally trained in public health but worked in the healthcare system the majority of their life. I think there is a window of opportunity to really look at a paradigm shift. And I know there's challenges and people don't agree, and there's tension as we transition. We all know that we need to make some changes in our healthcare system. We all know that 3 to 5 cents were spent on prevention versus treatment, and that we really need to look to more upstream interventions. And so this transition is really going from the disease treatment to prevention. And Walter Bortz wrote in a book, Next Medicine, he talked about a community getting together up in Northern California. And I love this story because I think it's so telling to really how just kind of that new paradigm shift in the mental model. We're really looking at the assets that we have. And it was a local hospital who had a trauma center, and they had many different sectors. So they had transportation, they had the school district, they had physicians, they had the hospital sitting at the table. And they were discussing a mountainous area that had a very steep cliff. And on this steep cliff, they quite often had accidents, and very tragic accidents. And so the hospital was really sitting and saying, well, we need to get a helicopter so we can airlift them more quickly to the trauma center. Okay, that's good. We need to have more surgeons on call in the emergency department so that they're available and ready for these trauma cases. And someone from transportation said, what about if we put up a guardrail and prevent them from going over the cliff in the first place? That's a new mental model. Not that there's probably not going to continue to be accidents, but that's us looking upstream and saying, how can we serve our communities better, rather than just serving them one at a time as they come into our emergency department. We'll always be there, but what if we had a mental model as an entire industry that looked at caring for our community versus treating trauma, late-stage crisis care? And I could replicate that scenario in many different arenas, and you all know what I'm talking about. And then it's really moving from a hospital and physician-centered to community-centered. Often we say the people in the ICU would have been dead 10 years ago. And we're seeing more and more late-stage illnesses, more chronic diseases in our hospitals, higher acuities, and really looking at how we can do more outpatient and in the community. So that focus is from, the hospital with walls to the hospital without walls. And I often say the hospital of the future isn't a hospital at all. It's a new mental model. We're always going to need hospital beds. But a part of a system, a health system, is really looking at how do we care for our community before they come in, and then what about after they leave? What about that traumatic brain injury patient that the guardrail didn't stop and needs ongoing care? And they're left into the community with a provider there that has limited resources. in terms of the psychosocial support that's needed? How about caring for children or other needs that that family might have? We need service there. We don't necessarily need better policies, but we need better relationships and better opportunities to serve our communities better. And then looking at the hospital and physicians as dispensers of information, to where you can Google just about anything, right? And so how do we transition that model? What does that look like? How do we get good information to people? What does that new model look like? And we're often looking at the return on investment, or I say, you know, the volume. How many patients do we see? You know, how many patients do we have today? What's our census? How many surgeries did we have? How many births did we have? And that was an important financial metric, because hospitals need to be solvent and financially viable, to a return on life, to say, how did we treat that patient when they were having surgery or when they were a patient here? And did their health improve? That's a different model. Lots of transition there. And then really looking to where, you know, many hospitals, and this is where I think faith-based health systems have a unique role, and a strong advocate of faith-based health systems. Because most not-for-profit health systems look at charity care and unreimbursed Medicaid or Medicare as kind of their community benefit, or what we like to call unmanaged charity care. Again, that late stage, once they end up in the ED, versus a transition in the new model and the new vision of community health development, to where we're really looking at how can we create better community to better serve each other, so that we have a more comprehensive model of care and a continuum of care. And that really benefits everyone, but it is a new model. And I think it really sets up that we need a new, in a sense, a new level of leadership, a new level of thinking that's going to take us to that new model. And it's going to take all of the different providers. So regardless of what your major is or what your profession is, you're part of the community, right? So you have a role in engaging and belonging and being a part of that. You know, technology, the GIS technology is something that I'm a big fan of, because it really takes a look at community. You know, often when we look at kind of hospital data and health data, we look at Excel tables and spreadsheets and look at, you know, how many patients we had and what percentage had this, what percentage had that. And what GIS technology does is it really takes our community and looks at it from a geographical perspective. So we can say, again, this is my patient, and I've just put over there some of the demographics of that patient. But you can imagine that can be replaced with many other different variables or social determinants or health ailments or assets in our community, to say how can we better mobilize our assets to really reach some of the challenges that we have in our community. And this will, again, is an amazing tool for helping us to better identify where we need to serve our community, and looking at, again, some measures of how we can better serve our communities. And again, what GIS technology allows us to do is take data in layers. So imagine layering that data with our census, with health status, with service utilization, with provider networks, with looking at variability, you know, in the market, and then even what's the market potential. So if we can look at it even from a, or, you know, where are our assets? Where are there opportunities to serve in our communities, is a powerful tool, so that we can be more intelligent on our service in our communities. Something that I do in any of the interventions that we're working on here at the hospital, or really in any of the work that I've done in the community, is really looking at it from a social ecological model. And this is an important piece because it takes a look at community. You know, often we look at individual interventions, like I said, going back to that patient, that one-on-one. And not that that's not important. Everyone needs that one-on-one. But if we're going to look at community and serving, we need to look at the big picture. And so not only do we look at the individual, but then look at what are those interpersonal relationships that they have. What about the institutions and the businesses and the organizations in your community? You know, what's their philosophy? Do you have a faith-based health system in your community that's mission is to extend the healing, teaching and healing ministry of Jesus Christ? I mean, that's an asset. How do you mobilize that mission? Do you have faith communities that could be galvanized? And if you present some of the needs through that geographic data to say, how can we better serve? What about community? Do we have coalitions? Do we create community so that people feel like they belong regardless of who they are? If they live in our community, they have a sense of belonging, a sense of ownership, a sense of responsibility. I mean, that's powerful. How are we creating that for our youth? I think about that with our youth, as well as our elderly. Everyone has a role. If you're breathing, you have a purpose. And what is that? How are we creating community? And then really looking at public policy. You know, what are some of the policies that help support this? All the way from the local city level to the county, to the state, and the national levels that help us support the work that we're doing. And in the hospital setting, when we're looking at community benefit, we often say to the government, we're going to serve the poor, and we're going to provide charity care. You can help us, or you can hurt us. We prefer that you help us. And so that we're shaping and involved in the policies so that we can better serve, I think is an important message. And then if we're looking at, you know, how do we serve the community? What are some of the things that we need to look at in terms of, you know, who's living there and where are they? So often, by training, I'm a health educator. And so, you know, when I started my career, I thought, I'm just going to do individual health education. Everybody's at the stage of action, right, in the trans-theoretical model of change. Everyone's ready to, you know, quit smoking, lose weight. Wrong. We all know that's wrong. Because, you know what, if you don't have a job, you don't know where your next meal is going to come from, you know, you are under immense amounts of stress in your personal and professional life. That 99-cent or $3.99 or $5.99 pizza to feed your family is going to be a lot easier. So again, looking at all of the levels. If you're homeless, okay, you know, you're not going to care what you're necessarily, it's getting food in your belly, right? I mean, it's at a different level. So we really need to look at where is our community in terms of just those basic needs. Are they met? If our basic needs aren't met, we're not going to be able to do healthy eating, active living, and all the other great things that we know help promote health. And so, are we meeting people at the point of where they are? And that's really critical. And that's so often, I often spend a lot of time in the emergency department because I think it's a microcosm of our community. And if you look at what's being manifested and presented in the emergency department, it's often, you know, some type of disease or pain or whatever physical ailment might be manifested in the emotional or other issues. And we're trying to treat it at the physical level when we're not getting down and looking at some of the basic needs, whether or not they, you know, have a home, have transportation. They can't get to the doctor. So, really assessing that. But that can't be solved by one entity. That has to be solved by community. And then elevating that. So, if we get the basic needs met, what about the disease process? Are we focusing on existing problems and conditions or underlying? What are we looking at? If someone is really battling cancer, they're probably not going to be necessarily in that proactive approach, in that prevention piece. Although some people could argue that's when they start, really looking at prevention and more of a proactive approach, because I think there can be prevention at all levels. But again, you get my point that, there is this hierarchy of really looking at those levels of health. And then people can start looking at the mental, physical, spiritual, and emotional levels of health. And this is so important, because then when we reach wellness, when you're capable of being who you are, then we can serve those that are in the emergency stage, right? But we need to be creating community so that we're all pushing us to those higher levels of health, so that we are temples of God and that we are able to help other people and to serve our communities. So it's not about us and them, it's about all of us, and embracing each other and supporting each other and serving each other, so that we can be really focusing in on a healthy community. So about 12 years ago, I started getting into kind of stepping out of the hospital and really getting into more of a healthy community movement, because clearly realized if I was going to do prevention and wellness and promoting health in the hospital system, I couldn't do it alone. And so I went into the community and I said, let's really pull community together. Let's define what health is. Let's, embrace that, engage that, and move forward as a community. And everybody said, well, so you want to build a hospital? Because I'd been a healthcare administrator, that was just the natural default. And I said, no, I want to build a healthy community. Well, what does that mean? Well, what that meant to me might have been something different to someone else. So it really needs to be defined by community. For me, in a healthy community, I want a running trail in my backyard. I want access to a farmer's market and fresh fruits and vegetables. I want to be able to, use public transportation so I'm not having to get in my car. I want a neighborhood and a community. I want a faith community accessible. I want good schools. I want my children to be able to walk to school. Okay? But that might not be the same definition for everybody. So what we really started looking at is how can we create kind of a physical environment to promote health, and how can we create systems that promote health. And it's really looking at eventually some of the policies in our local community. So we call it policies, environment, and systems. And Healthy People 2020 are really national health objectives that public health uses guiding measures. And in 2020, they added this, and it really would have helped me in 2010 if they would have added this. But at the bottom there, creating social and physical environments that promote good health for all. That's powerful. Yes, they're going to look at promoting healthy development and health behaviors, eliminating preventable disease and achieving health equity, eliminate disparities, improve health for all groups. But this was a new objective. And so this really, I think, gave impetus to moving forward with creating community and serving by creating those systems of care. And it's not just a formal system. We often call it the system with no wrong door. Does that make sense? That we're working and operating as community so that members of community can access what they need because there is a supportive social system involved. And so, if we're talking about, it's not just programs. And so I actually started working with cities. Go figure, a health educator working with planners. We have different language. And when we first started the conversation, planners would look at me and they'd say, what can I do to promote health? And I said, every decision that you make promotes health. And I think we can translate that to a lot of other professions in our communities. Reframe that question. And so I use this as an example probably of what we don't want necessarily in our local communities. Very car-centric. What's the problem with being car-centric? It is, lots of pollution, plus people are less active. My husband always says the downfall of society are garage door openers and air conditioners. Because we get in our cars, we open up our garage doors and we head on out, and then we come back and we don't connect. We aren't community. And so we're not walking by, seeing how people are, checking, our elderly neighbors. How are you today? That it really does create community. Small sidewalks, no parking. What about bike trails? What about kids walking to school? And so can we create environments that do support health, that do support connectivity, that do support connection to each other and to our Creator? And this, is an example of a walking trail. This doesn't have to be in the country. We can create walking trails and environments like this, even on campus. We can create it in our communities. But we have to start with saying, we want something different than what we have. And how do we create that? And that's really engaging community. So again, open access to walking trails, open access to nature, access to healthy foods. Do we have, do we have donut shops and fast food restaurants everywhere? Liquor stores? Or do we have farmers markets and grocery stores? Do you think there's any correlation between crime, liquor stores, obesity, to, some of the issues that we're facing in community? And so really looking at coming together and saying, we want something different. And so one of the things that we've done is a very extensive Healthy Communities initiative. And again, that's serving our communities by not us going in and saying, well, you know what you need? Because how well does that work? I have an 18 and a 16-year-old daughter, and it works really well. This is what you need, and they listen all the time. No, that's not how it works. How can we build on the intelligence of our community? How can we build on the assets of our community? How can we build on what our community has, the different sectors of our community? And that includes all of us. So that's not just someone else's job, but also that says that we have ownership and responsibility, right, to creating community by engaging people in the conversation, in the planning process. My dad used to say, if you don't invite people to the launch, don't expect them to be there for the crash landing. So true. How do we engage community in what we're doing? Another thing that we're doing within the health system is a faith and health initiative. And that's really connecting with our faith communities and saying, how can we work with you to support you to better serve your communities? I mean, can you see how this a partnership, by whether it's providing data, providing resources, helping them to shape the message. 75% of our healthcare costs are affiliated with chronic diseases, which have underlying health behaviors that attribute to them. And they're all pretty much, very similar common health behaviors. And who broker, what our behaviors are often based in our values. And the faith community is often brokers of values. So how can we partner with our faith communities better? Even looking at the faith communities and their role in terms of being mental health providers in our community. They don't think of themselves as mental health providers, but they are so often. And how can we better equip, better partner with them so that we can build community? We focus in on 3 areas here within the health system. And this is, and I always say, we look at that spectrum of prevention, or that social ecological model. And then we also look at how are we looking from our sidewalks to our EDs, and then after they go home. So how are we promoting, physical activity and the built environment, and access to healthy foods, farmers markets? How are we, how is the faith community, helping with community gardens and co-ops, and perhaps getting some of those, that fresh produce to our schools and to homeless shelters? And then teaching people how to cook. That's all community. That can't be done by one single entity. And that's serving, that's helping, that's meeting them, at their point in their area of need. And then really looking at our children, investing in our children, looking at developing healthcare pipelines for our children, investing in our children from the time they're born, helping to promote breastfeeding, all the way through graduating high school. So looking at some of the health challenges with our homeless. We have a horrible problem with sex trafficking in our backyard. That's our community. 12-year-old girls are being sold into prostitution in San Bernardino. That's not okay. That is not okay. How can we as community engage so that we all can thrive and heal? And then, another part of, that we're really going to be faced with our children is childhood obesity. It's not an image issue. It's really a pipeline of a lot of chronic diseases. And we're seeing this everywhere. So how are we engaging and promoting that healthy community so that we're not escalating the epidemic of obesity, but turning that around? Because that has many societal consequences that we all need to be looking at and finding out how we can better serve in meaningful ways that make a difference. And then again, just really looking at mental illness. And this is where we all need to come in, the faith communities, our senior centers, our schools, our health systems, and say, how can we do some primary prevention? How can we, and literally I challenged local builders to say, what can you do in your community in terms of design that helps prevent mental illness? And at first they thought, okay, the crazy woman again. But what about creating opportunities for socializing? What about creating environments for gatherings? Again, going back to the garage doors and the air conditioning. So we can look at even our built environment so that we are able to take people aside and just really connect with them on a level. Again, going back to, do we have a community that cares about each other, that's connected to each other, Do you know your neighbors? And how can we remove that stigma for mental illness and really look at how we can care for our community? And this is depression and other mental illnesses are on the rise and really impacting our community in significant and serious ways. So again, getting back to how we're looking at the hospital of the future is putting that patient in the middle, or that community in the middle, and then providing all of the services around them. And really, I think the patient-centered model doesn't happen inside the hospital, but it happens in community and service. And looking at how are we creating those social systems or those systems of support to help support that health. Again, a very different model, because there might not be reimbursements for some of that, right? But how are we going to create and have a new level of leadership that says some of the things happening in our community aren't okay, and we're going to take ownership and make a difference? Again, going back to that new level of thinking, we need leaders in our communities that are really going to stop for a moment, not necessarily look at the fires burning each day, although we definitely need to look at the fires that are happening. But what are the underlying trends and what are the forces of change? Often it's not what you know, and when we're focused in on our four walls and our data sets, right? We think we know. It's what we don't know that won't make the intervention successful. Have we gone out into our communities and driven around and got out of our cars and walked the sidewalks and looked at what people are walking in and where they're shopping and the resources or lack thereof? Or do you see the resources that we have in community? What are the underlying trends and forces of change so that we can serve community? Or is it us and them? But the reality is we're all community. I would say new skills for the future. What are those skill sets? What are those competencies? Especially as when I opened up, I talked about that paradigm shift to where it was physician and hospital centered in terms of data. Now we have open data, right? Even teaching. I mean, you could Google just about anything. So is it the information that's going to make a difference? Or is it seeing those interrelationships of the community issues and what's happening in community and serving that's going to make a difference? So looking at those interrelationships, not things or snapshots or judgment on, what's manifesting in that emergency department. My daughter sent me a little picture text the other day, and it was of a girl, it looked like she was in serious distress. And on the bottom caption it said, "Don't judge me. You don't know the storms I've been through. You don't know the storms that I've asked her. Don't judge her. You don't know the storms I've asked her to go through. God." And I think that so often we look at what's manifesting and not the underlying. And that's how can we do that in community? When we drive through a community and we say, and we see 12-year-olds being sold into prostitution, we see bail bond billboards and spearmint rhino billboards and liquor stores everywhere, nowhere to walk, fast food restaurants in every corner, liquor stores everywhere, no grocery store to be found. What's our role in serving community? And again, moving beyond that blame. And to say, as a community, we could all blame, right? We're in a political season right now. It's easy to blame. somebody's fault. We'll always have political challenges. But again, how can we move beyond that and say, as a community, how can we move towards solutions? How can we really look at areas of high impact? You know, what's going to make a difference? How can we really, you know, serve our communities? Those of you that are working, you know, internationally. I mean, if you go into a community and there's so many needs, often what's the one single thing that you can do that's going to make a difference? Get clean water, right? I mean, those are your basics. Yeah. So you want to look at what's your area of highest impact. And it's no different than if you're overseas or you're in the backyard here at Loma Linda. What are the areas of highest impact? Where are we going to make a difference? And then again, just avoid looking at that symptomatic solution. If we're always just putting a Band-Aid and we're not looking at the underlying causes and issues and forces that are creating childhood obesity, that are increasing suicide rates in our area, and we're just constantly focusing in on that one suicide, or you know, that one child, and not looking at the larger picture, often we can miss it. And not that we should not help that one individual. I'm not saying that, but looking at it in terms of community and how can we make a difference. I like to look at this really in terms of you know, how we do this. We have disruptive technology. You know, like the internet disrupted the whole travel industry. And I like to look at kind of this work in working in communities as disruptive partnerships. And it's really a partnership that causes a change or a paradigm shift in public health practices, healthcare, community-based organizations, and the public's lives. And I challenge each and every one of you to think about what is that disruptive partnership in community that can transform. Because those opportunities are in front of us. They really are. And I think it's just connecting and finding what those are, and not ruling anyone out, any of our providers out, any of our community members out, but really taking a look at how can we create healthy community. So I ask you, as future leaders, or not even future leaders, as current leaders and leaders in your community, regardless of how you define that, how can you imagine a better community, one that does reach that ultimate level of wellness, where we have people that are physically healthy, mentally healthy, and spiritually healthy? Yes, perhaps I'm a little bit Pollyannish, but I really believe that we can make a difference by serving our community and just getting out, rolling up our sleeves, asking, having good information and perhaps some technology to really make a difference. Because it's not going to be just me, just a health system. It's going to be all of us working together to make a change. And it starts in the here and the now. So I thank you, and I'll open it up for questions if anyone has any questions.
Well, just a comment. One of the things I noticed earlier this week, I was traveling on the bus to this location, and I saw a man in the community. He was on the bus with a trolley, and the trolley was filled with insulin. What's the thing? Insulin.
Oh wow.
Syringe, yeah, the boxes, a lot. And so I bent over and I asked him, I said, where are you taking those to? So he said, he no longer uses it. He's taking them back to Loma Linda so they can dispose of it. So I asked him why. So he said, I used to be huge, but now I lost over 95 pounds and I no longer need those of the insulin. And that spoke a lot to me.
Mm-hmm.
It tells me that this hospital is doing something in the community. Because here this man is no longer able to, and he said, I used to be on a power chair
Wow.
for many years, and now I feel better, and now I'm no longer taking insulin.
Wow.
And that made me feel better about my institution.
Good.
So it
Good.
simply means that the institution is doing a lot to the community.
Yeah. And you know, I mean, I think, thank you for sharing that story. And I think, you know, the more that we can share those stories of successes, they don't become just a story, you know, but they become really the way of doing things. And there's a lot of great things that we're doing, but we could always be doing, you know, how can we be doing something, you know, be doing better? And I think that is a perfect example of what we're doing right and how can we do more of that. Yeah. Others?
Can I share a story too?
Certainly.
So I got on a plane to Denver to fly here, and the guy that I'm sitting next to, he wants to know where I'm going. I said, I'm going to go out. I'm going to California, and I'm going to be taking some classes. He says, oh, what kind of classes? And I said, well, I'm a chaplain. Oh, he goes, are you going to Loma Linda? I said, actually I am. I said, and we got to talking, and I said, so are you a Seventh-day Adventist? He said, no. I said, well, how did you know about Loma Linda? Well, I live around there. Okay. So I get off the airplane, and I go to get my rental car. The gentleman says, what are you doing here? And I said, well, I'm taking some classes. Again, he knows about Loma Linda. He brings it up.
Yeah.
I go to leave, and the gentleman at the gate where I get my rental car, he says, where are you going? And I said, oh, I'm going to Loma Linda. He says, oh, are you going to the hospital there? He starts talking to me about Loma Linda. I'm thinking, is everybody around here about Loma Linda?
Yeah. You want to talk about community? You know, there's a large community.
I mean,
So.
even starting in Denver.
Yeah. Yeah, that's great. I mean, I'm sure you can hear that story pretty much internationally.
I mean, you can hear it as Seventh-day Adventists. We all know Loma Linda. But I was just surprised that all of these people who are not, who live in your community, know about who you are.
Well, because if you look at the 4 million people in Riverside and San Bernardino County, the minority is Seventh-day Adventist. So, you know, it's a very large community that we're touching and serving. And I'm out in the community all the time kind of getting feedback. So I get the positives and I get the negatives. I love the positives, so always thank you for sharing those. But one area that I always got a lot of really positive feedback was, oh, your chaplains are great. And I would say, well, you know, what are we doing in terms of our sending our chaplain? I mean, this is in the community. This isn't at Loma Linda. And it's the chaplains that were trained here at Loma Linda. They say, we're from Loma Linda. And so people attach meaning to that. And, you know, I just thought, wow, that's great in terms of how we can create community. And, you know, what we can bring to individuals and to people is really powerful. So. Yeah, thank you for whatever the chaplains are doing in our local community here is making a difference. It really is. So I tell Jim Creek that all the time. Hope he shares it because it's always an affirming word. Other comments? All right, well, thank you for your time. Yeah.